Okay, so first of all, Kalimera. My name is Claudio Ronco. I'm a nephrologist from Italy, and I've been always interested in intensive care and nephrology, creating a new specialty called critical care nephrology, which is the interest in the kidney disease in critically ill patients. There are today international guidelines on how to operate in these patients, and sometimes it's not so easy to apply these guidelines in our daily practice because of local problems or sometimes lack of technology. But nevertheless, we should remember that guidelines are just recommendations and not mandatory an obligation. I think guidelines are specific indications on how to better try our approach to the critically ill patient. And another important thing, in fact, is that we recently advocated the use of what we call the nephrology rapid response team, with the application of new biomarkers and new strategies to diagnose acute kidney injury much earlier than in the past. Then we can stimulate the nephrologist in the hospital to go at the bedside of the patient and put together strategies in bundles or in checklists that are designed to prevent the occurrence of AKI or to limit the level of severity of AKI. By doing this, in our hospital in Vicenza, Italy, we could actually reduce the number of patients requiring renal replacement therapy, which is a great success. Now, of course, I think that all this has to deal with the fact that acute kidney injury and the incidence of this disorder has been in the past underestimated. It has been not considered as important as myocardial infarction or acute coronary syndrome. Today, people know that acute kidney injury is important. It is important because it may affect ICU length of stay, hospital length of stay, cost in treating this patient, and especially because it may evolve into chronic kidney disease that may also affect the quality and quantity of life of patient after ICU discharge. So I think we need today to understand that acute kidney injury is important, is a deadly condition. It's a condition affecting long-term outcomes. We need to try to make all efforts to avoid the syndrome, to mitigate the damage in the kidney, and to promote recovery of renal function after this occurs in critically ill patients. This can only be achieved through a true collaboration between nephrologists, cardiologists, cardiac surgeon, intensivists, so different disciplines in the hospital that should actually operate together for the good outcome of these patients.